Well, thanks, Tony, for the introduction, and it's nice to be here. I've been to Cairns for quite some time. Oh, isn't this working? Oh, no, obviously. That's all right. I can raise my... No, there's nothing there. I don't think there's anything there. That's all right. I can raise my voice. I was expecting the microphone to pick up the sound. So this, what we've been doing in Western Australia is really developing this concept of what's called health impact assessment and applying it to climate change. And my colleague Diane Katurian is over there, and Helen Brown is one of my PhD students. So basically the content of what I'll be saying is to give a very, very brief overview of health impact assessment and then into health risk assessment, and then talk a bit more about the role of health impact assessment in climate change and health. So health impact assessment is somewhat parallel to environmental impact assessment, and it's used to evaluate the potential impacts during the planning stages. So ideally health impact assessment comes before any policy plan or project. And this is a WHO definition. It's a combination of procedures or methods by which a policy, program or project may be judged as to the effects it may have on the health of the population. So again, similar to environmental impact assessment, which focuses on impact on the environment. And one of the important aims about health impact assessment, it looks at the possibilities of maximising the positive health impacts of a policy, program or project and minimising the negatives. Environmental impact assessment doesn't tend to look much at maximising the positives, it just looks at minimising negatives. And it's based on these values that are listed there. And basically the health impact assessment process, again, parallels environmental impact and goes through these 8 steps. And this is really focusing on the way it's used at the moment, which is for projects, not used much for policies or programs. So there is a screening stage, a scoping stage, profiling, assessing the health impacts, including a risk assessment, and then risk management, what would need to be done to minimise the negative risks and optimising the positives, and then a decision making and implementation, and then following that, the monitoring, environmental and health auditing post the proposal evaluation. That's after the implementation. So this can be summarised into these steps. So the screening step is, does the situation require health impact assessment? Scoping identifies the impacts and sets the boundaries. Profiling identifies the population that will be affected, and in particular those vulnerable groups within the population. And then the risk assessment looks at what are the risks and benefits, and risk management, minimising the risks and maximising the benefits. So we used this strategy a couple of years ago when we started looking at adaptation strategies for climate change in Western Australia, and this is a publication that came from that study. This was done by myself and Diane and Helen, and it went quite a way, but then after we'd done this, we realised that there were some difficulties, particularly in the risk assessment part, trying to get people to have a better idea of how to assess the risks. Because in this document we went through a risk ranking process, so we tried to get an estimation as to what were going to be the extreme impacts and what were going to be low. And we went to various groups of experts using focus groups to come up with that, but it was still quite a difficult process. And that, coupled with some developments in the environmental impact assessment process, we got to consider much more about what we're talking about in terms of health risk assessment. And that's one of the key parts of HIA, both at the scoping stage and at the risk assessment stage. And we have put together a health risk assessment document in Western Australia in 2006, which is on the department's website. Now, in risk assessment, and this is using the old Australian Standard 4360, which has now been superseded by Australian Standard 31000, this uses, together with a lot of other risk ranking processes, uses basically a two-dimensional matrix of consequences and likelihood, going from catastrophic down to negligible, and then from in likelihood in terms of almost certain to rare or improbable. And so what we're trying to do here in terms of application to climate change as well as projects is to look at this link between health hazards and health impacts. And if we can identify the health hazard and the exposure pathway, then that allows the potential for the management or mitigation of the hazards. Whereas if the event happens, then we're looking at trying to mitigate the consequences of the action of the event that occurred. So we match this together with the health impact assessment processes on the left, and this process of risk assessment, which is set out here, is got the arrow there for scoping, but this also can apply to step 4, the risk assessment stage. And so for each of the identified potential impacts, we looked at 2 consequence assessments that are required to determine the potential health consequences to communities. So we divided the health impact into the acute effects on health and chronic effects on health. And we also determined the potential consequences to the health services. So this may be a fairly small to read, but I can give you the reference. So basically, after various focus groups and other discussions, we came up with some better descriptors of catastrophic through to negligible or slight. For both, the middle column there is for the acute health consequences. So this is very much contextually based in terms of, say, the WA community, and probably for Australia-wide. We would regard catastrophic as greater than 1 fatality. And remember, this is a prediction. It's not looking at it after the event. So if you allow it to happen, you're going to get 1 fatality, and then you accept that as a consequence. Or in terms of chronic health consequences, I'll just look at the top one here. The chronic health effect requiring medical treatment for 10 to 15% of the population at risk. So either of those 2 would be catastrophic, and then that scales down to negligible or slight at the bottom, no chronic health effect, no fatality, no permanent disability, no non-permanent injuries, no acute effect requiring hospitalisation, no evacuation. So that would be negligible or slight. Then the third part of that is the consequences to the healthcare system. And so this is put in monetary terms or in terms of demand. So if the cost is high or the demand exceeds the capacity, then that would be seen as catastrophic in the context. And then there is the likelihood dimension of the matrix, where we have going from rare or remote to almost certain. And so this looks at the likelihood of the incident happening. And then you combine those 2, and you can develop or use this risk ranking matrix to identify the risk as either being extreme or very low. And then there are risk management criteria that can be applied to extreme risk being potentially unacceptable modification of the proposal down to very low. Then to go on to so this is the adaptation. So the adaptation to climate change goes through the impacts, considers the impacts and the vulnerability, and we assess the costs and benefits and explore adaptation options to come up with some form of effective adaptation. Then this is now focusing on the project that we're doing in Perth, and this is on the urban adaptation, and this is Helen Browner's about a year into her doctoral thesis on this topic. So the health impacts will not be felt uniformly, and I think we've heard enough this afternoon to appreciate most of that. So the purpose of this particular research is to identify and assess adaptation strategies designed to reduce the potential health impacts of a warming climate in an urban environment, using Perth as a case study. So the specific objectives: assess and compare level of risk, identify and model key physical and social environmental variables, identify leverage points in the system more likely to result in effective strategies, evaluate the effectiveness of adaptation measures, and to evaluate the application of methods used in the project to assess other impacts of adaptation strategies. So again, we're considering the health impact of an adaptation strategy as part of this process. And so we're modifying the health impact assessment process to now introduce this concept of systems dynamics. This is in conjunction with a couple of people at ANU. So we're trying to use this health impact of climate change. We're trying to apply health impact assessment and incorporate into that a systems dynamics approach. That's the study slide I've seen already. So the profiling stage, what we're looking at there is profiling the vulnerability to the suburb level, the sensitive and adaptive capacity of the determinants, development of a vulnerability matrix, and this is going to be in conjunction with health authorities and local government agencies. So for this process, I won't go through this in much detail, but basically we use these expert focus groups to look at trying to assess the risk, the consequences in terms of acute, chronic and effect on health services, and then come up with the risk ranking using that process that I just outlined. Now, the point about bringing the systems dynamics into it is that we have to consider all of the other interactions that can happen with health. So we're not going to just look at health agencies, we need to be talking to agriculture, planning and others to bring in this systems dynamics type of approach to this piece of research. And systems dynamics is basically a study of complex systems, looking at cause and effect relationships in this kind of a way. So you have a problem, a solution environment, and you can have lots of feedback loops within this kind of system. And so these kind of diagrams have been produced and are available. So what we're going to try to do is to put this into the local situation for Perth. Then to look at inferences for adaptation management. So what is the model trying to tell us? Which adaptation strategies should we be targeting? How can opportunities be maximised and the adverse effects be minimised? And a couple of other research projects we're doing a somewhat similar exercise but without the systems dynamics in a rural area down in the Blackwood Stirling area of Perth, of Western Australia. And we're also involved in a project with WHO in the Pacific Islands involving Nauru, Vanuatu and the Solomon Islands. And again, we're refining